The next speaker is Dr. Pooja, and she'll be talking about the OCT-based topographer and tips to enhance everyday practice. So the next few talks we'll be having on the OCT topographer, the MS39 machine, which is the new kid on the block for the OCT-based topography. Yeah, go ahead, please.
Thank you, and I would like to thank the entire My Healthscape team for inviting me here. So in OCT-based topographers, I'm sure we are very good experienced speakers here. So everyone's going to cover different aspects of it. So I thought I'll cover the epithelial mapping aspect in refractive surgery. So we do come across cases where you see an inferior steepening here, but there's no posterior elevation, maybe a little bump here, but otherwise fairly normal, and the biomechanics and all other parameters also look to be within normal limits. So why is there an inferior steepening? Are we looking at a case of a form thrust keratoconus, or is it like, but why normal biomechanics if it's a form thrust keratoconus? We do have multiple indices across different technologies who do tell us whether it's a healthy cornea or a suspect cornea, and for us to tell us that whether we can go ahead with refractive surgery or not. But are these indices enough for today's practice, or do we need something more? Now, what current topographers do is they measure the surface of whatever we see, but the true surface actually is the underlying stroma, because epithelium can be of any morphology, a regular or an irregular one, and that will actually mask the true surface of the cornea. So that is why we do need to look at the epithelium, and which is beyond what a shine plug based topographer will give us. So how do we solve this problem? The problem is so the answer is in OCT based topographer, because it does give us an epithelial mapping and better information of the anterior chamber and the lens, and the repeatability of most of these corneal parameters is better than that of shine plug based imaging, and it has a faster scanning speed, and the repeatability is better in mild to moderate keratoconic eyes. Now, MS39 is nothing but it's a hybrid topographer, a combination of high-resolution spectral domain OCT with a placido disc-based imaging. And if, as refractive surgeons, we all know that many a times we do know that the placido disc imaging picks up those subtle cases in a very nice way or in a very superior way compared to that of a shine plug-based imaging. So this is what we get, and we get accurate measurements in elevations, curvature, and power when it comes to the whole cornea. So MS39 gives us like all these parameters, the topographic and the tomographic data, epithelial and stromal thickness, and multiple other things, but I will focus on the epithelium and the stromal part of it. So how does it help us in differentiating from normal to suspect cases? Let's come back to the case. Inferior steepening, no posterior elevation, and the parameters look seemingly with normal range. So when we look at the MS39 mapping, you can actually see that the area of inferior steepening has an inferior epithelial irregularity, and the epithelium on the inferior zone is little thicker compared to that of the central zone. So yes, there is a little bit of irregularity, and there is no posterior elevation, and the stromal elevation is also absent. So that means you see the inferior steepening because of the epithelial hyperplasia in the inferior region, and this is not a case of form thrust keratoconus, but a case of an ocular surface inflammation, and this is just an epithelial masquerade. So coming to the second case, this patient wanted refractive surgery, looks fairly normal, only the OSDI scoring is 12.5. And if you see the topography also looks seemingly normal, maybe a little small bump here, but otherwise fairly normal. Now, when we go to the epithelial mapping, the topography is normal, but it does show a little bit of inferior hyperplasia when you see the epithelial mapping. Now, why is this irregular? Are we looking at, are we just overlooking into this case, and should we just go ahead and do a refractive surgery, or should we investigate it further? So it is known that whenever you have a normal epithelium, your nerves are always going to be healthy. The corneal nerves, which is the corneal health is going to be healthy. The hemostasis is going to be healthy. But whenever there are a lot of epithelial irregularities and dendritic cells, that's when you get a irregular epithelium. And whenever you do a refractive surgery or any of such patients, or even if you do a cataract surgery or a smile surgery, post-op, these patients are going to have an aggression of the ocular surface inflammation. The epithelial remodeling is going to be quite erratic. It's not going to heal in a proper way, and that's when you have a poor quality of vision. So it's not just your surgery which is at fault, but if your epithelium to begin with is irregular and you just go ahead and do a surgery, post-op the patients may have a 20/20 vision but a poor quality of vision, and that is what you need to look at. Another which good feature it gives you is the epithelial, in addition to the epithelial mapping, you get the epithelial zernick also. So it's not just about the aberrations of the cornea anymore, you get an aberration of an epithelium. So if you look at this case, this is a very angry looking epithelium, and at the same time the sphere and cylindrical is almost 0.5, which is just coming from the epithelium. So again, the patient is unhappy post-refractive surgery, and it's not because of your refractive surgery but an angry looking epithelium which is leading to all this aberrations, and that is why the quality of vision is poor. Now again, this is one more case, fairly healthy looking topography, looks fit for refractive surgery, no elevations, everything looks fine. But the epithelium is an O-shaped epithelium. Like if you see here, it's a normal topography, but it's an O-shaped epithelium. And Professor Einstein has clearly proven that even in a healthy cornea, if you see an O-shaped pattern, that may be an early sign of inflammation, and that can be an early sign what you see in the form first keratoconic patient or a keratoconus patient. So O sign epithelium is a classic sign that you are dealing with something suspicious, even if the topography is healthy. And if you look at this case this is if you look at the stromal elevation, you can see that there is an early stromal elevation present. The posterior elevation is not present, but the stromal elevation is present, and that is why, yes, you are looking at a case of early form first keratoconus. So epithelium does give us a lot of answers, whether you are dealing with a healthy cornea, whether you're dealing with an unhealthy cornea. It may also help you predict how your post-op outcomes are going to be. And if you have in an OCT-based topographer, if you get a stromal elevation, you can pick up these changes before even it's manifested on the topography.